feel like sometimes our government just says, "The hell with you," and we need to change things.
Yeah, good question, Kathy. I think why we've seen such a warped, crony capitalist healthcare society over the last 60 years is because the government has put its thumb on what the free market mechanisms are that would actually have created good competition, that would have created an environment to where people could actually know what they're paying before they actually go and get services. So
I have to disagree with that.
Sure.
I'm a registered nurse, retired, so I've been in healthcare, for more than half of my life. And part of the problem with healthcare and access is because money and capitalism is involved in it. It's a money-making venture. So insurance companies are incentivized to deny benefits to make money. Hospitals are incentivized to get people out quickly. And I know people don't like government health care, but you look at other countries where they have single-payer systems, their health outcomes are much better than ours. And
you have to wait for 2 years to see a doctor.
Well,
but
not necessarily.
I do. I know people who have died waiting for months to see a doctor.
I've had patients.
Name names.
Times over.
Give us a name. Give us one name.
In our system, who couldn't get care because their insurance deductible was too high.
Exactly.
I worked with treating patients who had hepatitis C. Those drugs were astronomically expensive, as were some of the other drugs used to treat other conditions that I took care of. And I had patients say, I simply can't afford this medication because their deductible's too high.
Yeah.
They bought an insurance plan that they could afford in the marketplace, but it gave them terrible coverage. So don't say that.
Do you think that the
single-payer-
insurance? Do you think that the insurance companies is really a free market system where you can go out and really choose in Indiana between the best insurance companies for you? Do you think we are being served by saying, "Hey, I want to go find and shop around insurance," or do you get forced into kind of finding a plan that you just kind of have to accept because it's either your job or it's a government insurance program? Or do you think that the free market is allowed to actually create the best insurance companies and then we can go out? It doesn't matter about the state borders, right? And why is that?
No, I don't, because being a retired person now, I do have the option of selecting different plans.
Yeah.
Whereas when I was employed, I had to take what was offered. And I was very fortunate that I had good coverage. But I do have like that free market choice now.
Can you
And
get better care or better insurance now than you could when you were employed?
it's about comparable.
Okay.
It's about comparable.
Can we go across, and I'm genuinely asking, because you know this world better than I do, can we go across state lines to find insurance? Could I find an insurance company in Wyoming that I feel like is going to serve me and my family?
No, I don't believe
So
you
why
can.
not? I can do that with cars. Why can't I do that with insurance?
I don't think it's going to solve the problem, because the bottom line is the insurance companies are incentivized to make money for their shareholders, and they do that by denying care and charging high premiums, high deductibles, and not being transparent with their consumers.
So the insurance companies care more about their shareholders.
Oh, absolutely.
than people. And I would agree with that. And I would agree with that. So what I'm saying is, if you allow for free market competition, they're going to start caring about, that's how the market works.
No,
I think we've created a cartel system.
You need to get the money out of it. The money incentive needs to be out of it. That whole middleman of the health insurance needs to be out of it. And the pharmacy benefit managers need to be out of it.
Okay, so you just say get the money out of it.
Everybody's getting a piece of the pie.
Okay, get the money out of it. I kind of agree with that, but that means also get the government money out of there too, right? Oh, so not get the money out of it, but
Medicare.
yeah.
Medicare has worked well for seniors. Okay, it's worked well. Why can't we do that for everybody? My father, a lifelong Republican, very conservative, when he retired, he couldn't believe how good Medicare was. And he says, I don't know why we don't do this for everybody, instead of all this stuff that people have to go through in their pre-retirement years.
Do Do you know what that would cost the United States?
It's cheaper. It's cheaper. It is cheaper.
I think that's the issue right there. Is okay if we really truly care about people. Does the government have a better motive? Will they do it more efficiently, effectively than the free market?
Yes.
Now I disagree that the free market would do it better, but I don't think we have a free market in healthcare right now. I think that's a problem. I think we have a crony capitalistic market. So you're not actually seeing the free market function at all. I would argue that the free market will serve people better. Why? Because when businesses make money on the happiness and the service to their customers, and their customers are more happy, are better served, they're going to make more money.
No.
That's the incentive.
No.
I mean, that's how every other industry works, doesn't it?
No.
I mean,
I think healthcare is just very different.
Okay,
You're dealing with people when they're sick. You're dealing with people when they're sick.
I get it.
And they have strong needs. And then I kind of want to get back to get my question answered as to what's going to be done in our state specifically to address all these cuts that have been done to public health with regards to maternal, infant care, mental health care. I'd kind of like to get an answer to that question. I think we kind of got sidetracked.
Yeah, so for the mental health, it's something near and dear to my heart. I believe that there is a physical, an emotional, mental, and spiritual component to somebody's holistic health. Would you agree with that? Okay, so one thing I think that we haven't done well, this is one of the things my office is focusing on, is making sure that we can get the nonprofits in communities and faith communities engaged in helping people with mental health. Because the government does not do a good job of caring for somebody's mental health. I would make that argument 10 times over.
So we're going to pray the babies well?
So what I would say is when you have people who truly care in the nonprofit world, would you say nonprofits serve people better than government bureaucrats? No. Wow. Weird.
Depends for what? For what purpose?
Well, I think just across the board in general.
Running food banks and that kind of thing.
How much of each dollar in a government system goes to the cause itself? Whenever you're a nonprofit, there's a standard, right? If about 90% of your dollar is going to what the cause is, and 10% covers the administrative cost, you're actually a viable, good nonprofit. In the government's case, it's less than 40 cents. 40 cents of that dollar is all that's going to the cause. The rest of it's being gobbled up by government bureaucracy, by administrative costs. So I would say nonprofits, just the way they spend the money, is actually getting to the people to help people more so than government does.
I don't know. I think nonprofits they skim off the top too. And I'm just saying the cuts in public health this last legislative session. What's going to be done now to help women and infants and people with chronic illnesses, seniors, people that are depending on those funds? What's going to be done to help them?
Well, again, that's what I said. One of the things my office specifically has done is to galvanize the nonprofit and faith communities. And I know you're shaking your head, but that's something that hasn't been done well in the past. So we're saying, why don't we try that? Why don't we give that a shot to see if we can start addressing some of the mental health concerns that we have?
We already have an infrastructure. We already have an infrastructure of mental health clinics, maternity clinics, things like that.
What would you like to see?
Why not? I'd like to see them, fully funded and
some more
supported
money.
And
more money.
And especially support the rural counties. I mean, the hospitals are closing, they're dropping like flies in rural counties. And there's like places where women have to drive 3 hours to get maternity care now.
Yeah.
And what nonprofit's going to help them in rural, I don't know, Scott County or wherever there's no hospital, no obstetricians? What nonprofit is going to help that woman?
I know multiple nonprofits right now in rural communities that serve pregnant women and mothers who have given birth all the way up.
But there's no obstetricians there.
Well,
how are they going to help
some of them
give
have
diapers?
them. Some of them have them. Yeah.
I mean, that's not what they need. They need prenatal care.
Okay, I know multiple nonprofits that actually do prenatal care.
Name them.
Such as?
So Pregnancy Life Choices is one right now.
No.
Yes, they do. They've got medical professionals.
They put a nurse.
Yes, they do. I know. I can tell you the names of a couple.
Do they they have obstetricians and midwives there.
Some of them do. Some
Not
of them
some
do.
of them, but not all of them.
Okay,
So
but
that is not the.
But, and I'm saying, just throwing more money at the problem, money that we don't have, by the way, just throwing more money at it is not
But
going
we're
to fix
going to
the
give it
problem.
to the
Taking
churches.
money away is not going to fix the
So
problem.
there's got to be money
Exactly.
there.
That's what I'm saying. Why don't we try working with people in communities that have a heart to serve?
Why don't we pay